As a physician yourself, how does this affect you?
It it impacts our decisions on how much to work, on how long to work, and that extrapolates out to the longer term. How many years can you keep doing it?
Hmm.
But just in terms of there is a constant deluge of requests to pick up shifts, and not just I work in three different sites in my home base. I try and locum on occasion in other places, and every morning I have requests from across the country, from all the different provinces, saying, "Can you take any number of shifts in our emerge and our emerge and our emerge?" And that's constant. And much as I would love to help, I can't usually ever leave where I am, or then the shifts that go unfilled here, and that problem is universal in Canada.
Did you say from across the country?
Absolutely. So in the Atlantic provinces, we're fortunate to have what's called the Atlantic license. So you can work in any of the four Atlantic provinces without any real challenges. But I've done locuming in the Northwest Territories, and I've had offers in Ontario, British Columbia, and the Prairie provinces as well. And because of my advocacy work with the Canadian Association, I stay in contact with all these organizations so that I'm aware of what's going on.
Hmm.
And yeah, the request for locums is never ending.
We were talking with the BC Rural Health Network a little while ago, and he said, there you can keep recruiting, but as we've been talking about, this is a nationwide, indeed a global issue. So you can only recruit so much because you're taking from the supply in another jurisdiction. So what do you see as a solution?
It's really really complicated, and so it's interesting listening to the comments you're getting on social media. The frustration, the anger, the sort of hopelessness that the public has, and some people in the business have as well. And that's because it's such a huge and complex beast that if you try and attack one particular problem without taking it at a systems level, you're pretty much guaranteed to fail.
Hmm.
And so the main issue I think we're looking at today is human health resources, absolute number of physicians. Now, our association predicted in 2013 or 2016 was our last statement, that we said by 2025 we're going to be minimum 1,500 emergency physicians short in the country. I think we were probably shy of that mark, but we were certainly accurate in the prediction. And so this has not been a surprise. We've seen this deficit coming for a long time. And now things are so bad that there is, I think, a perception that people don't want to do our job. And
Hmm.
that's not the case at all. It is a great job. It is an honor and a privilege to be an emergency physician. But yeah, it's really, really hard. And the workload has increased so much that a full time job now usually entails fewer hours than it used to, because the job is so mentally and physically exhausting,
Oh.
that in the old days 16 or 18 shifts in a month was common. Now it's getting very very rare because that pace at work is really not sustainable for a lot of people.